Hi, welcome to Care Samvaad with me, Murchi Hemant, and ఈరోజు నాతో పాటు ఉన్నారు Dr. B. Ravinder Reddy garu. Sir, welcome.
Thank you very much.
We have a lot of questions, and all those questions are in the air because these are gas-related questions.
Yes.
అంటే ఈ మధ్యకాలంలో మనకు చాలా మందిని చూస్తున్నాను సార్. ఇక్కడ నొప్పి అంటే గ్యాస్ అనుకున్నానండి, వీపు నొప్పి వస్తే గ్యాస్ అనుకున్నానండి, తలనొప్పి వచ్చిందంటే నాకు గ్యాస్ అని అర్థం అండి ఇలాంటివి చెప్పేస్తుంటారు. సో గ్యాస్ ఇస్ లైక్ ఎవ్రీవేర్, ఎవ్రీబడీస్ ప్రాబ్లమ్ రైట్ నౌ. సో ప్లీజ్ ఐ వాంట్ టు స్టార్ట్ ఆఫ్ బై ఆస్కింగ్, అసలు గ్యాస్ట్రోఇంటెస్టైనల్ ట్రాక్ట్, when do you go for surgery for this term, sir?
Well, gastrointestinal tract, the body law, it is the longest tract, right? It starts from the mouth till the anal canal, right? And it's nearly about 25 plus feet on an average, maybe more if we include all the convolutions of the small intestine. And interestingly enough, it is one of the three organs which is in direct connection with the external environment. Ante from the gali nunchi, right? Because I am talking to you, my mouth is open. When we are eating, it's open. So we are directly exposed to the external environment.
Right.
By virtue of this, the number of disease processes are quite high.
Okay.
As far as the disorders are concerned. At the same time, gastrointestinal tract is so very important that I don't know if you are, it may be coming as a shock that it has the highest amount of immune system in the body.
Oh, wow.
Right? Highest number of immune cells in the body. If you take, let's say, lymph nodes have, let's say 100 for the sake of discussion, let's say it has 100. Lymphatics have, let's say about 200. Skin, let's say it has about 75, right? By that scale, gastrointestinal tract has about 20,000.
Wow, okay.
Right? So
clearly way ahead.
Much ahead. In fact, the second brain in our intestines actually is in our whole body, apart from the main brain, is the gastrointestinal tract.
Correct.
Right? We are what our gastrointestinal tract is.
Correct.
That is introduction. So very often it is the acute conditions.
Right.
Acute conditions. Apart from trauma, obviously a trauma needs surgery. Acute conditions, and the gastrointestinal is a hollow tube with many convolutions, right? It has three solid organs on its sides, right? But the mainly it has hollow tubes. So whenever there is an infection, or whenever there is infection leading to a hole or a perforation as we call it, sometimes it can lead to an obstruction. Sometimes it can lead to such a bad infection that the entire blood supply is damaged, and then it's called intestinal gangrene. So these are the some of the acute conditions. The list is very long, but some of the acute conditions. Now, the non-acute conditions are actually more. Suppose we operate on 10 cases. Let's say we operate 10 cases in a week, right? Probably 7 or 8 of them they are non-emergency procedures.
Correct.
Right? In other words, they are elective procedures. What are the elective procedures? It could be a benign condition. It could be a cancerous condition. Very commonly, it is a benign condition. Perhaps if you go to a cancer hospital, maybe it is the converse. But ikkada we do most of it benign. Not that we do not do cancer, we also do cancer, but benign takes the preponderance. It could be stones. Very commonly, it is a gallbladder stones. In the gastrointestinal tract, it could be an ulcer that is not healing very well, or it could be an inflammation. This is also very common. There's a thing called inflammatory bowel disease. It's a very serious lifelong disease like asthma or diabetes or high blood pressure. Sometimes they go into complications. They form adhesions, they form connections between each, they cause complete obstruction. Then we'll have to operate on them. So the number of procedures that need surgery are quite huge.
Okay.
But let me hasten to add that if I see 10 patients with, let's say, gastrointestinal tract problems, maybe 2 of them need surgery. Not all of them do not need surgery.
Right.
Most of them need, you know what? Dietary adjustment, that's all.
Yeah.
Not even medicines.
Yeah.
Just dietary adjustments and lifestyle interventions, that's all.
Sir, when you say dietary and lifestyle interventions, please throw some light on that, sir.
Yes. So, like way back, Hippocrates once said that we are what we eat.
Correct.
And then his disciples actually said that disease resides in the guts, in the intestines. So, in other words, we are what we eat, but nowadays, more importantly, we are what we do not eat. Right? So, if you take somebody, I get quite a lot of patients with very common gastrointestinal problems, belching, burping, indigestion, burning sensation, coughing in the middle of the night. Again, it's because of the reflux. They put it under the two broad terms of gas or acidity. And very commonly, they come with constipation, right? And why does it happen? It is lack of fiber in our diet. Now, I'm going to use this fiber a lot in the next 5, 10, 15, 20 minutes, which we are interacting with. Because if at all your listeners or our listeners have to go away with one mantra point,
Sure.
right? And that is fiber.
Okay.
Right? So lifestyle, it starts with fiber. We should have adequate fiber. I'll come down to that, down the questions.
Sure.
We need to have adequate fiber. Every meal, every morsel of meal, every time we eat, prati mudda or spoon, we should be mindful of two things: how much protein it has, how much fiber it has.
Right.
Right. This is one side. The other side is, I would say, like, this is 33%. The remaining 33% is the physical activity, how active we are the whole day. That itself actually initiates the robustness of the functioning of the gastrointestinal tract. The last 33% is how our mentation is, how our mind is, how well we sleep, right? How well we are not overreacting to a smallest thing. For example, somebody, I take this example, if somebody has let's say a mosquito bite, right? Most often, many people actually, they are not bothered. But there are some individuals, if there's a mosquito bite, they react, they have redness, they have rashes, and their pain threshold, they have very significant pain. They have to apply some amrutanjan or some Vicks or some balm, to divert this thing. So that is their threshold. So everything again depends on how well we are mentally. So in other words, mindfulness. Again, I have a bit to say about mindfulness as we go further down.
Right. So coming back, they call the gut bugs, the gut microbiome. So how do they influence, a surgery before and after?
Right. So in 2002, we realized, when I was a medical student in 80s, we knew that there were intestinal bacteria, right? But at that point, none of us knew, because the only possible way was to do simple culture. But now, in 2002, they look at the genetic material in the stools or in the skin or in any of the body cavities. By that, we came to know that there are different kinds of, it's called microbiota, right? Microbiota are the number of microorganisms which live on and within us. Their genes are the microbiome.
Right.
That's the difference.
Okay.
Right? I'll give you an example. We have about 37 trillion cells on an average, right? And we have about 20,000 genes in us. We carry about, on us, we have about 39 trillion microbes. 39 trillion. That is 2 trillion more than our own cells.
Correct.
Right? So you, me, every living being, you see, not just human beings, living being, is a library, is a walking monument of a microorganism.
Right.
He, she, it, everything is alive, functioning well, mainly because of the microorganisms. So there's a paradigm shift. The way we absorb food, the way we eat food, the way we crave for the food, right? I'm sure Chala Mandi, after eating, they have to have some sweet, right? This is even in persons with diabetes.
Correct.
Right? People who are hypertensive and their doctor tells them you have to restrict the salt, they have salt cravings, right? Now we know that it is not their lack of willpower. They are being totally controlled by their microorganisms in their intestine, right? How does it act? Through many of the axes, axes, right? So the intestines are directly and indirectly connected, directly through a nerve called vagus nerve, indirectly by molecules it secretes through the brain. It's called gut-brain axis. Similarly, it's connected to the lungs, gut-lung. Similarly to the skin. Some people get skin infections very often. Commonest is very commonly you see people with psoriasis, right? They take Ayurvedic and everything. The root is actually lies in his or her intestine, right? Changing the good bugs. Or gut bone. Some people have knee replacements, osteoarthritis. That is everything relates to gut. So there was been a paradigm shift in early 2020s, 21, 22, 22, 23. Now we know that now we are beginning to understand the pivotal role of these microorganisms.
Correct.
If they don't take care of us, we don't survive.
Right.
Simple.
Sir, in your experience, have you seen cases where modulating the gut microbiome made a difference in recovery and complications?
Absolutely. So any patient, I just told you that I asked them what they have for breakfast.
Correct.
What did they have for dinner, right? If they say they skip the breakfast, I ask for previous meal. So I take about last 3 or 4 meals. It's called the nutrition, it's called recall history. And that tells me on an average how much of fiber a person is having.
Okay.
Right? So the robustness or the good bugs, population of the good bugs is directly related to what we feed them. Right? If we have a sugar-laced diet, we digest it. We have enzymes, digestion. We are not giving any of that to the bacteria. Right? But if you have a lot of vegetables and a lot of fruits, right, at least 100 grams per meal of vegetables and at least 50 to 60 to 70 grams of fruits a meal, we digest only a part of it. They are called low digestible or non-digestible carbohydrates, right? But who is digesting them? It is the microorganism.
Right.
And where the commonest amount of microorganisms present, they are in the left side of the large intestine. They are present everywhere. As we go down the intestine, right from the stomach onwards to the small intestine, the number of organisms per ml increases exponentially. Just I'll give you an example. On the left side of the large intestine, we call it descending colon, 1 ml or 1 gram of this intestinal content contains 1 followed by 14 zeros.
Wow.
1 ml or 1 gram, right? That is how much, how many. And what do they do on the left side? They are the huge fermentation factories.
Right.
Just like breweries,
Yeah.
we also have our own breweries. And which is the main actor in that brewery? It is actually a fungus.
Okay.
Right? We have very good fungus. And we have very good bacteria also. And they digest this, and in turn, they give us something. They are called short chain fatty acids, and they actually help. Now, in my patients, right, if their fiber intake is low, right, I actually give them, because if their diet is very suboptimal, let's say I'm giving them a date after a week or 10 days, I insist that they follow this particular diet, right? And I also tell them what to avoid, simple sugars, oily food, and other things, right? The third thing is, if there's an emergency or they are exposed to already antibiotics in another hospital and they have come here, then I have to give them a push, artificial good bugs. They are called prebiotics and probiotics.
Correct.
Right?
Yeah.
So,
Sir, I'm sure there are a lot of technical advancements with regards to GI surgery.
yes.
అన్నిట్లో మీకు చాలా ఎక్సైట్మెంట్ ఇచ్చేది ఏదండి?
Well, all are good, but at the same time, I'll answer that excitement question last.
Sure.
Right. The biggest thing is it's augmented reality.
Correct.
Right. Augmented reality is amazing. When we were medical students, we had to imagine things.
Correct.
But now the medical students, right?
Yes.
They have augmented reality. We dissected real human beings, dead bodies, real humans who were dead. But now in quite a few of the westernized, nations, they don't dissect, they have augmented reality, they look at it. So that is one aspect. The other aspect is artificial intelligence, right? Now it has done an amazing difference as far as the field of health is concerned, right? I would say about 50 to 55% is good, right?
Oh, okay.
But at the same time, because I'm being a devil's advocate here, 40 to 45% is not that good.
It is in the improving stages.
No. The more we improve, the more damage it can do.
Okay.
I'll tell you why. Let me talk about the good things, right? Good things are you use artificial intelligence for, let's say, to read a radiograph, an X-ray, or a CT scan, or an MRI, right? It'll give us the findings immediately, right? Or you use artificial intelligence for, nowadays we are getting stethoscopes. We no longer have to memorize how a murmur sounds when we were students, but now you just put it and you'll get the what kind of heart murmur it is, right? Or for that matter, echocardiogram, we just put the transducer over the heart and it tells us how is the heart functioning and how much of blood is coming out and all these things. This is a good point, right? The chances of humane error is minimized.
Right.
Now, what is the negative side of it, right? It is making us de-skilled because our people who had the skills to do a certain procedure, now they are using artificial intelligence, right? And their positive outcomes are much better. But if you remove the AI part from that, right, they have lost that skill of using their own intuition to actually pick it up. An example is, I think yesterday's journal, I read that 19 gastroenterologists in Poland, they were using artificial intelligence to diagnose polyps when they were doing colonoscopy. For some reason, for 3 weeks, that AI system broke down. So they had to rely on their conventional one. And guess what? They missed most of their findings.
Oh.
So they were de-skilled.
Correct.
Right? Now the other thing is...
dependency, if you must say.
Yeah.
Correct.
The other thing is misskilling.
Correct.
Misskilling, because artificial intelligence is not the panacea. It does... What is it? It's actually generating from the huge cloud of information.
Which already exists. Correct.
It is generating. It is not learning by itself. It is generating. It may generate something. It may not generate the correct thing. But once it generates, it thinks that is the right thing. So that is called bias.
Yeah.
Right. So we may fall victim to this.
Oh.
Right. The third thing is de-skilled, right? Where if you take a junior radiologist right now or a junior cardiologist, he or she will use artificial intelligence to diagnose it, right? If that breaks down, will he be good enough compared to his peers? No. So that is the second no. Now, to answer your question, what excites me the most, right? We have a thing called ERAS protocols, right? Enhanced recovery after surgery, ERAS.
Right.
It is nothing but something like an iPhone, right? I always give this example to my students. Now, Steve Jobs did not invent iPhone. He took the existing technology, the touch and the other things and the Bluetooth and everything. He put everything together and came up with this amazing thing called iPhone about more than 2 decades ago. And then others have copied and now we have excellent ones. ERAS protocol is the same thing. So we knew that if you control the pain, recovery is much faster. If you give early feeding to the patient, recovery is much faster. If you limit the fasting, recovery is much faster. You give the patient adequate mobility, encourage the patient to move very quickly, recovery is much faster. These are called ERAS protocols. So what am I excited about as from these three, artificial intelligence and augmented reality? The third one, it is the ERAS protocol. Oh, wow. Because we don't need to depend on any technology.
Correct.
Right? And that has been proven time and again in multiple centers in multiple countries.
Right.
So I'm excited with that. And my boss, when I was in the UK, was one of the first fathers of ERAS protocols, and I've been using that since the time I've come back.
So I am more excited because my next round is the rapid care round.
Right.
I'm going to ask questions and maybe one word answer cheyal, sir.
One word, huh?
Yeah.
I'll try.
Here we go. One food you think everyone should eat for better gut health?
High fiber diet.
Laparoscopy or open surgery? Which one do you enjoy more?
I enjoy open.
One song that always lifts your mood during the operation, if you must say.
Smooth Operator by Sade.
Oh. A book, podcast, or a quote that inspires you as a doctor.
Primum non nocere. It's a Latin word that says do not do further harm to the patients.
Okay. If not a surgeon, what would you have been?
Physicist, no doubt.
I'd say you would have been a great motivational speaker. 3 words that describe you inside and out. Inside and outside of the OT.
Inside and out, easygoing.
Favorite surgery to perform?
Favorite surgery? There are many, but for the sake of this discussion, let's say the commonest one I do is hernia.
All right. Morning or night surgeries? What's your preference?
It depends on the person, but I enjoy doing in the afternoon.
Okay. One medical innovation you wish existed?
Wow, I can't answer this in one question, but one thing is, if we had, whenever we overeat or whenever we see somebody who's obese, who's got excess overnutrition or excess calories, right? We should have some ways, genetically modify that person so that he or she will not feel hungry to the same extent. For example, you take a very obese individual. Let's say he has got.
Aren't there medicines right now doing the same?
Yeah, but they come with their own baggage.
I'm sure.
Yeah. So this thing is by using CRISPR and other genetic modifications,
Okay.
so that we are not dependent. Need to know on Tangala. So
Correct.
as long as you take, you're fine. But once you stop it,
You're going back to the original.
yeah, gradually.
Coffee or chai during long shifts?
Neither. It's matcha.
Matcha. Oh, wow. You're too fancy, sir. One word to describe surgery.
A surgeon is an operating physician.
Operating. Okay, well said. Finally, favorite medical movie or a show?
Medical movie or a show? I would say Lifeline.
Okay.
Lifeline was a thing that came out when I was in my graduate student. It was when we had black and white television, right? And it was a very long series. I still remember. So it's called Lifeline.
Right now, sir, The Good Doctor or anything like that?
Which one? Oh, they are like glorified.
Glorified.
They are glorified.
I think it's high time you should star in one of these, sir. Let's make it.
Yeah, why not? I'm looking forward to that.
Done, sir. Thank you so much.
Thank you
I'll
very
give you a
much.
firm shake hand again.
Thank you very
Thank
much.
you, sir. Thanks so
Thank
much.
you.